Hello friends, I am Dr. Anil Pande. I am a senior consultant neurosurgeon at Apollo Hospitals at OMR, Perangudi. In the people's mind, whenever there is a need for a neurosurgical opinion, there is a lot of apprehension and doubt, because people are scared that when we operate on the brain and the spinal cord, it is an exceedingly difficult operation, and anybody who has a spinal operation tends to lose his legs or lose his hands, or they get great amount of difficulty. It was definitely so before the 1960s and earlier part of this century. But with the coming of the MRI scans and CT scans, we were able to visualize more correctly where the tumor was in relationship to the brain and in relationship to the spinal cord. The current concept of keyhole surgery, pinhole surgery, and minimally invasive neurosurgery has been there for more than 30 years now. Once the microscope came, then we did not have to open the whole brain or the complete part of the spinal column to get to the spinal cord. With using the microscope and using navigation as of now, we can make very limited openings and then use the endoscope or microsurgical equipment to reach the tumor and to remove it safely without any deficit to the patients. To this minimally invasive neurosurgery, we combine certain concept like awake neurosurgery, where the patient remains awake during the complete removal of the tumor. For example, a musician can be playing music. A patient who is a journalist can keep talking, so that while we are removing the tumor from near his speech area, we do not inadvertently damage that area. But conventional neurosurgery also continues to happen, because everything need not be pinhole, need not be keyhole. So for every particular type of problem in the brain and in the spinal cord, there are certain specific type of surgery which is indicated. In some people, if the tumor is very small, we do what is called radiosurgery. We give precise planned radiation to a thing, and that is called radiosurgery, although it is a wrong way of calling it. But that is also neurosurgery, where we use focused radiation. Like for example, we now use photons to target certain types of tumors like chordomas. So one of my patients who came to me after many years, so about 15 years back, I had operated on him. So we had done a spinal tumor for him. He had a tumor which was causing urinary problems and difficulty in walking. He was unable to pass urine, and surprisingly this was caused by a tumor which was sitting inside his bony canal. So we did a minimally invasive neurosurgery, where using the microscope we only remove a little bit of the bone on one side. On one side the bone is removed and the tumor is removed, and immediately after that he got his control of his urinary bladder. He was able to pass urine properly, and his pain and weakness of his lower limb disappeared. The patient himself described that, this keyhole spine surgery was done so many years back, and the patient has got such good quality of life. In fact, every day we get patients who come back and said that, why did I suffer for so many years with back pain or neck pain? I should have seen a neurosurgeon and opted for surgery so that I did not have to suffer. So the main point of this talk to the people is generally that the fear which you have, if you have a significant back pain or neck pain, is to realize that most of these things are very easily treatable. Most of these conditions are first managed conservatively. That means we give you medication and only do surgery if it is indicated. And the final point which I want to take is that in case you have such a condition, you should not be scared of it. in today's world, the very reason that we have so many gadgets which have come into the market, these make surgery very safe. And the best thing which we can say about modern surgery, neurosurgery especially, is that it is safe and it can give excellent outcomes, and the patient is the most important person for us, and for that these skills are developed over years so that we can give the best patient outcomes. Thank you.
நம்பர் திருநாவுக்கரசு, தையூர்லேருந்து, சொந்த ஊர் தையூர். யூனியன் 1 ப்ராப்ளத்தினால தான் நான் டாக்டர் அனில் பண்டு சாரை பார்த்தேன். அவர் அப்போது எனக்கு 2005 7வது மாதம் சர்ஜரி பண்ணார். எம்ஆர்ஐ ஸ்கேன் எடுக்க சொல்லி எனக்கு நியூரோ சர்ஜரி பண்ணி கொடுத்தாங்க. அன்னிலேருந்து இது வரைக்கும் அவர் சொன்னதுக்கு தான் பண்ணிக்கிறேன். அவர் நல்லா பண்ணி கொடுத்தாரு. அதுலேருந்து நான் நல்லா ஆக்டிவாக இருக்கிறேன், நல்லா இருக்கிறேன். 15 வருஷம் தொடர்ந்து அவரே ஃபாலோ பண்ணி அவர் எங்கெங்கெல்லாம் இருக்கிறாரோ அதை அந்த இடத்துல போய் பார்த்து நான் ட்ரீட்மெண்ட் பண்ணுறேன். இப்போதைக்கு அப்போல தொடர்ந்து பார்த்துன்னு இருக்கிறேன். நான் நல்லா இருக்கிறேன். சிறப்பாக எனக்கு அந்த ஆப்ரேஷன் பண்ணதுலேருந்து எந்த குறைபாடும் இல்லை. எல்லா விஷயத்துலையும் நல்லா ஆக்டிவாக இருக்கிறேன். யூனியன் நல்லா போகுது. மற்றபடி எனக்கு சின்ன சின்ன எந்த இது வந்தாலும் நான் டாக்டர் அனில் பண்டு சார்கிட்ட தான் பார்த்துக்கின்னு ட்ரீட்மெண்ட் பண்ணி போயின்னுக்கிறேன். இனி வரைக்கும் நல்லா இருக்குது, எந்த குறைபாடும் இல்லை. இனி எனக்கு ஆப்ரேஷன் பண்ணி இனியோட 15 வருஷம் 4 நாள் ஆகுது.